Diabetes is ever present even if we don't want it to be.
Diabetes is a 24/7 condition for the rest of our lives.
Not just your hobbies, but also your work life. Absolutely everything is impacted by diabetes.
You need to always stay on guard. You always have to make extra decisions.
In the morning, in the afternoon, in the evening.
Everything that I do is informed by how much I'm trying to manage my blood sugars.
There's 5% or 10% of my brain that is dedicated to diabetes 24/7, 365, and it'll continue to be until I die. If I'm going out, I'm okay to forget my house keys, but I would not forget my pouch that has my insulin and the essentials that I need.
The most difficult thing about living with diabetes is uncertainty.
Stigma and discrimination.
Accepting that it will limit you somehow. There are limits you don't choose. You cannot avoid them. I've always said that diabetes doesn't define me. It doesn't say who I am, but it has certainly shaped the person I am today.
Living with diabetes for the last 27 years, people thought that I'm strong, but actually I'm not that strong.
As good as you can be and as good as you are with your management, there are some unknowns.
I'm not a superhero. I mean, I can also feel burnout and feeling tired of surviving with diabetes.
There are many moments when diabetes can be really overwhelming. It's ever present. It doesn't let you think straight. It doesn't let you function properly. It is very demoralizing.
I have seen a lot of patients who get to a point of their life when they get sick and tired of taking their medicines.
Sometimes the healthcare team cannot help you. There's not access to mental health resources as easily as the physical health resources.
Mental well-being is not something that most doctors are concerned about.
I'm not satisfied with the kind of support that I'm getting. I think there is need for more.
Adding the psychological assessment on day one and also a yearly review on how we run through our life with diabetes journey.
Because diabetes causes a lot of distress and a lot of fatigue that has an effect on people's well-being.
A lot of doctors here do not talk about doing exercise. They don't prescribe exercise as medicine and tell people with diabetes how to do the exercise. They don't do diabetes education that is so much important.
Community is an integral part of well-being, and it would be amazing for the healthcare system to mirror this. It's the sharing that makes it easier.
Knowing that I have a safe space to talk about what I'm going through.
Living with diabetes should not be a hindrance to what you want to do in life. It should not take away your dreams and your passion for life.
No one wants it. We could do away with it. But we can also turn diabetes into a magnificent journey.
When someone with diabetes comes to the consultations, if we see that person as a person, not as a patient, we are seeing a human being. And that human being could also be my son, my mother, my brother. So we will treat them differently. If we do that with every patient, the world can change.
And sorry, BG is okay. It's telling me it's okay.